This is Connecticut Images with Joe Vegliante. Today, Joe welcomes Dr. Dawn Tobin from the Tobin Family Chiropractic Center. Now, here's Joe Vegliante.
Hi, I'm Joe Vegliante, and I have an important guest today, and I'll tell you how I found her. We all have pain, and I have back pain, severe back pain. I had it for years. I tried acupuncture. I'll tell you the story. I went in and they put a bunch of needles in me, and they have a thing called a rheostat. They adjust the electricity that goes through you, but evidently it was on high. When the young lady pushed the switch, I almost flew off the table. I was going to get electrocuted. That's one of my experiences. Then I had cortisone shots in my back. It lasts for about 3 or 4 months, and it gets a little annoying. Then I went to a chiropractor, and he twisted me like a pretzel, and I just about could get into the car. And then I went to this exercise class, and they had me on a table, bending me back and forth and legs, and every time they were doing it, I was getting worse and worse. I was kind of disgusted. So I said, probably I'm going to have to live with this the rest of my life. One day I was reading one of the local gazettes, and I saw, we could get you out of pain, and it was Dawn Tobin. And she explains how when she was a young lady, she went to a chiropractor and her mother took care of her, and she got healed. Later on in life, she fell off a ski slope or something like that. She was on skis and she didn't have to get an operation, and they cured her. I said, bye, this is good, it's for me. So I called up her practice, and a wonderful, sweet young lady, I think her name is Liz, charming voice, and I said, I'm Joe Vegliante, and I have a back pain that's killing me. You think you can help me? She said, oh, of course we could. That's all I had to hear. Set up an appointment, I ran down there. Now, I was going to see a female chiropractor. In my mind, I visioned her to be about 6'6" tall, big hands, about 300 pounds, so she'd flip you and throw you around on the table. I come in, I see this lovely young lady, my guest tonight, Dawn Tobin. Dawn, welcome to my show tonight.
Thank you for having me.
This is the young lady that took care of me. She said, we could take care of you, Joe, and she did. And she took x-rays, and the rest is history. I'm starting to feel about 80% better than when I went in. I was in real serious condition. Dawn, tell the folks what you did to me.
Well, I didn't electrocute you, and I didn't flip you around on the table, right? So first we talked, right? We took your history, and we talked about what you'd done and what you hadn't done. We talked about your general health and what was going on with you overall. And then we did an exam. We checked your spine, we checked your nervous system, we did a thermal scan and a surface EMG test. And then to see what your structure was, we took some x-rays. And once we put all the information together, I knew exactly where your nerve interference was. I knew exactly how I needed to adjust you, and then we started adjusting you. And with each adjustment, we're taking the pressure off the nerves, and your body is able to heal because you're connected to the power that heals you, which is coming from the brain. So it's really that simple.
Well, you make it simple, but it's a lot more than that. And I see you have a skeleton. Oh, how did you get into the practice in the first place? Let's talk about your young days. We were 5 years old when you had trouble, or 6?
I was maybe 5 or 6 when my mom got into a car accident. She had a pretty bad whiplash injury, and I was with her as a young child when she went for her visits. And the chiropractor noticed that I looked a little not right, and he asked, what was going on with your daughter. And my mom explained that I kind of was sick all the time, and I was thin, and I was pale, and that I had had a traumatic birth with a lot of pulling and a lot of the forceps delivery and the vacuum extractor. And so he said, I bet you something's off, let's check her. So that's when I got my first adjustment, and the rest is history. Until college, when I broke my back skiing.
You broke your back skiing?
I fractured my spine skiing.
Wow.
And I was absolutely terrified to go to the hospital. And so when I got back from my trip and I was at college, and I said, I'm over 18 and you can't make me go to the hospital, I'm going to a chiropractor. So I met a really awesome guy at Penn State who took care of me, got me through my injury, and helped my body heal itself. So I never had to have surgery, I never had to have injections, I never was on pain pills, and so I feel like it saved my life.
So that's why you went into chiropractic?
Yeah, yeah.
Okay, now I notice you have a
skeleton.
skeleton
spine.
on the desk here. Maybe
Yes.
you can sort of hold it up and explain what happens.
Okay, so the way your body works is the brain controls everything, and the brain gets the messages to the body, so telling your heart how fast to beat. When you eat your lunch, the food gets digested. If you cut your finger, there's a healing process that happens, and those healing messages come from the brain. We call it your innate intelligence. So it's the intelligence that you're born with. It's the intelligence that took 2 cells and created a whole baby and knew exactly how to grow that human being. So that intelligence is your innate intelligence. You're born with it, and it's always available 100%. The messages come down through the spine, out through the nerves, and run the body. If there's any interference in the way of slight misalignments, or perhaps a traumatic birth like I had myself, pressure on the brainstem, pressure on the spine can create a disconnect or an interference, and then you have a lowered state of health. So with chiropractic, what we do is we find out where you have interference. We make very specific, scientific, gentle adjustments, taking the pressure off of the nerve, making sure we clear from the top down, because the brainstem, the bottom of the brainstem sits right here, around the first bone. So we make sure there's no interference, and that way that innate can flow and it can heal your body. And that's chiropractic.
What are these things?
These are the nerves.
Oh, those are the nerves?
These are the nerves, and they don't end here in a real body. They continue on, and they connect into all the organs. The low back has nerves that come down and make that dreaded sciatic nerve that everyone likes to talk about, you know. So the nerves that go down the legs originate from the low back. The nerves that go down the arms, when people have numbness or tingling in their hands, we can, check the nerves as they exit from the bottom of the neck, make sure that there's no interference there. So yeah, these are the nerves here. This is what carries your healing messages.
Now, what is that other?
This is just the top of the head, so the spine.
Well, that's important. You say
Yes.
just the top. My God,
Yes.
that's the important part.
So this is the back of the skull, so
Yes.
this would be right here.
Yes.
So the back of the skull and the top bone in the neck, C1 or the atlas, and C2 or the axis. These are, quite frankly, the most important bones in your body to make sure that they're not causing interference, because when the brain is sending the messages down through the spine, if there's interference in the top part here, it's literally choking off, your power and creating a state of dis-ease, meaning your body's not functioning like it could, like it should. And when we clear that out, when we clear out the pressure off of the bottom of your brainstem, all kinds of wonderful healing takes place.
So everything is adjusted by the brain. The brain cell, the brain, you have to have that free flow. And if you don't have that free flow, you're in trouble.
You have a lowered state of health. It's like living your life with a dimmer switch on. So you were born to be bright, right? You were born to be bright, and subluxation, or this nerve interference, puts the dimmer switch on and dims you. So chiropractic just takes the pressure off and allows you to be bright again.
It sounds so simple, doesn't it?
It is simple.
Puts
It's
a lot
so
of work
simple that
together.
even chiropractors can mix it up sometimes.
They could, yeah.
Yeah. So you had mentioned, going to places where they stretched you like a rubber band, or where they
one of them,
twisted
they
you
put me on a
around.
machine and they stretched me. I thought I'd be 6 feet tall by the time I got out of there. They just stretched me and put it back, stretched me, and
Yeah.
oh,
So there's some chiropractors who add in a lot of stuff like physical therapy, or vitamins, or heat or ice, which, that's all sort of separate from the true chiropractic, which is making sure that the spine and the nervous system are free of any interference.
Now with that, if you have pains in the legs, the knees, and all that, those adjustments you do up in the neck area, that will relieve it?
It takes, it's not, the goal isn't doing this adjustment to have pain relief down here. The goal is doing this adjustment if and when there's interference, so that your body can function at a higher level. So if the fibers of the nerve that sense pain have pressure on them, you're going to have pain. If the part of the nerve that runs your organs, or your immune response, or your breathing has pressure on it, then you'll have an issue there. So yes, absolutely, it can be where we we adjust up here and pain is relieved in the legs. But it's not like this is the leg adjustment up here. This is sort of the master control center of the entire body.
That's interesting. You know, I never knew that.
I told you that.
You told me that, but I never knew it. And my audience out there, I always tell them when I find somebody interesting or something that will help them. We have a vast audience, you know, in North Haven.
I know.
And we want them to have the best. From septic tanks to eye surgery to you name it, I put it on the show. And when I met you, I said, you have to go on and tell these people, because I know a lot of people that are suffering with back pains, and that's awful.
I mean, and if there's one thing that I would want to impress upon people is that your body is so much more powerful than anyone has allowed you to believe. You don't have a headache because you have an aspirin deficit in your system, you know. So does
that take care of headaches if people have migraines and stuff like that?
I mean, if there's subluxation, which again is the pressure on the nerves, pressure on the spine, pressure on the bottom of the brainstem, if there's subluxation and we reduce it, but with the adjustment, then the whole body functions better. So we've seen everything from little babies with constipation or colic to people with, you know, radiating leg pain, or people with allergies or asthma. So it's every condition you can think of, which is just the body not functioning correctly.
You know what I want to do? I want to put your name on the board. It's going to come up on the screen, and there's no charge for this. She'll give you a free, what do we call it,
a consultation.
A consultation,
we'll sit down and we'll talk, and I'll let you tell me about you, and I'll tell you how I think I can help you.
Yeah, that's
and then
important.
We'll figure out what to do moving forward.
That's great.
It's pretty simple.
Let's talk more about things you can cure. This is good.
Well, you like the word cure, I know you do, but I will say that in chiropractic we say, but we don't cure anything. We just allow your body to heal itself. So the power that made you is the only thing that can heal you. So
I talk to myself every evening. I say, it's time you cure yourself.
You told me. I love it.
Well, I'm working for it. I also keep smiling.
I know. It's contagious.
Yes, it's contagious. It never goes out of style. So let's talk more about the skeleton there and what people could do to that are in pain, or to protect their body, or different things like that.
Well, what would you like to know?
Well, people are in pain. Pain is pain, and they want to know everything when you're in pain.
I know.
What could I do? I know you're working on my neck and all that, and I have a question, like when you have me and you take my neck and you go, you know, and I hear a little cracking in there. What's happening?
Well, so nothing's cracking. I can assure you that. There's nothing breaking, snapping, cracking, or there's not a tendon.
What am I hearing?
You are hearing. So each joint, when the bone meets the bone and there's a joint, it's not just bone on bone. There's cartilage and there's a capsule and there's fluid in there, kind of like a piston of a car. It's not just metal scraping on metal. Yeah. So we have this nice little joint capsule with fluid in there, and when things are stuck or out of alignment and we put a little pressure into them to get it moving and free it up, you hear a shift of the molecules from that, kind of like if you open a bottle of champagne and you hear a really loud pop, right? It's just a shift of those molecules from tight in the liquid to releasing.
Yeah, but once you open it, look at all the pleasure you get from that.
Well, that's what happens when you get adjusted. It turns your power on, right?
That's it. That's very good.
That's it. Yeah. That's all we do. We turn power on. A lot of people think of chiropractors as we're bone doctors or back doctors, but we're not bone doctors. We're power doctors. We're making sure that that brain, which has all that innate intelligence that runs that body perfectly, we just want to make sure that your innate is flowing, your power's on, and that you're functioning at the best you can be.
I like the way you're wording that. For the simple layman like myself, I can understand that.
Well, good.
Power's on, switch, you're doing this and that.
Yeah.
But some of the chiropractors out there, they work differently than you do. I've been to a few of them, and they put you on a table and they bend and they twist, and I don't feel as well as when I left you.
Well, Well, and I will say there are people that that for the adjustment that they get in my office, there is some bending and twisting. That's what they need. You know, that's not what's best for you based on when we talked about your history and we talked about your MRI findings and we talked about you. That's not the right adjustment for you, and that's where I think there's a little bit of an art to it, because it's not cookie cutter. It's not, you know, everyone gets the same thing every time. It's finding what works best for the patient technique-wise and what they can handle, and then just doing the job. So getting the job done is the important thing. The how we get the job done, meaning what type of adjustment, can vary. I mean, when I adjust a newborn baby, because the birth process is one of the most traumatic things a human being can go through, even if there's no complications. So when I adjust a newborn baby, the pressure that I use is not even if you were to take a marshmallow between your hands and you were just to squish it a teeny bit. That's how you adjust a newborn. You know, if I adjust a 300-pound electrician, I might have to get on top of him and really use my body weight and my mechanics to move that joint. So how I adjust you is specific for what Joe needs, right?
Joe likes what you're doing because I'm feeling better.
Good. I like when Joe likes that.
Yeah, I like that better.
I like when Joe's happy.
We have a lot more to go, so let's talk more about the skeleton and.
Okay.
Because I'm very interested in this, and I'm sure my audience is interested in what goes on in the back, you know. And I was always wondering, how the hell do you do someone that's 300 pounds? I see some of your patients to straighten them out.
I make sure I keep my strength up, but it's also a lot about there's a finesse to being able to, for lack of a better phrase, throw your body weight around. So if you thought I was going to be 6'6", 300 pounds, there are chiropractors who are very big like that, and they might do things where they might use their arms, but I might have to, you know, position myself where I'm going to use my body mechanics. So it's
now your table that we're on. It's the first time I see something like that. I don't know. You crank it up and it goes up, and you push it down, or can you explain about your?
So that's
table?
one technique. I
like that
It's
technique.
a drop. It's called a drop table, and so instead of taking you, because knowing what's going on with your back, we wouldn't want to twist you around. Instead of taking you and, you know, wringing out your spine like a dish towel, that's not what you need. So I'm making sure that your pelvis is aligned and the table pops up maybe about an inch, and then I put my hand in the exact position that we need to get the nerve interference clear. And with the drop of the table, there's I do a little push, the table drops, so the table's doing all of the loud noise, not your spine. So it's a little more gentle.
I'll tell you, I had my wife with me one day, and while you were treating me, and when I come out, she said, "Joe, what the hell was all that noise? Bang, bang, bang." I said, "I know, it's the table that goes down."
Yes, the yoga ladies downstairs love the banging. So so maybe another thing a little example I can give you is I have this orange rubber band on my wrist, and this is a really simple way to explain to people what chiropractors do. So if I were to take this rubber band and take this healthy finger, and I were to put the rubber band around my finger like that, right away you can notice there's some changes happening, right? So right away, this part of my finger isn't as happy as it was 30 seconds ago.
It's turning red now.
Right. So let's, for the sake of an example, take my finger and turn it upside down. So this is the brain. Here's the top of the spine, and then the body, right? So that's that right there. So if the average person in America, if they had, say, a back pain, a pain down here, what's the first thing that usually people do? What do they usually reach for when they have an ache or a pain? Usually,
what do they reach for?
Like an Advil or something.
An Advil or something, yeah.
So the pain's down here, and they're taking an Advil, and maybe it dulls the pain because it covers it up. It doesn't take it away. It just masks it. But then when the Advil wears off, the pain comes back. So if this is average Mary American, Mary's going to then say, all right, now I got to go to the doctor because clearly I have a problem down here in my back because it hurts. So let me take myself to the doctor and see what they have to say. So she says, doctor, you know, what's going on? I have this ache or pain. And he says, well, let me give you some stronger medication, right? So maybe we'll do a prescription anti-inflammatory. Try that for 2 weeks. So
that rolls the kidneys, you know.
It does, and it, you know, and if your body is creating inflammation, it's part of a healing process, and you cover it up with a drug. When the drug wears away, the inflammation is just going to come back. So anyway, now you can see my fingers really not happy.
This is the best example I've seen.
Okay, well, so if now Mary goes back to the doctor.
Turn blue now.
I know, I better hurry up, right? So if Mary goes back to the doctor and says, you know, the pills you gave me, as soon as they were off, the pain's still there, and in fact it's actually getting worse. I think we really have a problem. So then the doctor says, okay, let's do some tests. So he does an x-ray, an MRI, blood work, you know, whatever testing you could think of, and they find nothing wrong. So he says, okay, I'm going to have you take a steroid pack, because that's a really strong anti-inflammatory. So let's take the steroid pack and let's see what happens. And although she feels better while she's on the steroids, when the steroids leave her system, the inflammation comes back and she still has pain, and now it's worse. It's getting worse. So now she's scared. So she goes for a second opinion, goes through a whole other round of tests. They say, Mary, we have figured out what is wrong with you. You have digititis, inflammation of the finger. Get it? Digititis. So, and we're just going to cut it off. That's the only thing that we could think of, is we're going to surgically remove it. The pain will go away. You know, you'll get on with your life, and that's, you know, we're not cutting fingers off, but that's typically what happens. You go in and you've had a prolonged pain, and they want to do surgery, right?
Your finger's turning blue.
I know. So she's very disgruntled. She's very disenchanted. She wants to, you know, wants to think about it. She obviously doesn't want to have body parts removed. So she leaves the doctor's office, and she's across the street. She sees a sign, and it says chiropractor. And so she says, I'm going to go try one of these guys. So she walks in, and this chiropractor that she meets does a 40-minute exam. He does a hair test. He does a vitamin analysis. He scans her feet, because maybe if she has some foot inserts, it'll make her feel better. He sticks some electricity through her, because maybe she's suffering from a lack of electricity. Does all this stuff. She walks out, bags of vitamins, foot inserts, electrocuted. Still feels the same, still has the problem, because the pain's down here, but where's the interference? So she calls her friend, and she says, Jane, I think I'm just going to go ahead and have the surgery. And Jane says, have you tried chiropractic? And she said, yeah, I just did. And her friend says, but did you try my chiropractor? And she said, well, aren't they all the same? And that's where it comes into play, where you know that there's such a wide variety of what people do in chiropractic under the scope of our license that's not chiropractic. So Jane says, you got to try my chiropractor. She's different. She knows that there's a power in the brain that's going to run the body. She knows there's an innate intelligence that when it's connected, it's going to regenerate the tissues. It's going to allow the body to heal itself. So, okay, I'll try your chiropractor. So Mary goes in, has a 10-minute exam, gets an x-ray taken, gets a nerve scan, and she says, doctor, can you help me? And the doctor says, yes, Mary, I know what the problem is. The problem is, it's the second bone in your neck. She says, but what? My pain's in my back. How can that be? And Mary says, I don't understand this. And she said, well, when you understand that there's a power in here that runs the body, and when the brain is connected, everything heals. When there's a pressure up here, you have a disconnect, there's an interference, and your body's not going to heal. So what are you going to do? Mary says, what are you going to do? And the doctor says, we're going to slowly start to take the pressure off.
Now I can see, I don't know if the camera can pick that up, but her finger is actually blue. It's from here down, it's blue. So like a lack of blood.
So with an adjustment, we slowly start to take the pressure off. And Mary says, wow, that already feels better. And the doctor says, well, I don't care how you feel. I care how you function, because it's not about just your back pain. It's about your heart cells and your liver cells and your lung cells and everything that's getting the life choked out of it because of this subluxation. So after we do the adjustments and we get the pressure off, there's going to be some real good healing that happens.
Look at that. It's normal. It's just like the other part.
So there's going to be some real great healing that happens.
Those few seconds you talked about that, I learned a lot. And I'm sure my audience learned a lot out there.
Well, that's why you had me here, Joe.
You take care of older people. people, younger people, any kind of people.
Definitely.
That, that come in.
I've gone to the hospital and adjusted babies, right when they were born.
Yeah. I know when I'm in there, you have a waiting list of people waiting to come in, all sizes and shapes. And when I look at them, I don't think I'm that fat, some of them. But you do a good job on all of them. You do a good job on me, and I'm very, very pleased.
Thank you.
So I'd like to put, if we could put this chart back up on the wall, board again, and contact Dr. Tobin. It's a free examination for the first time. And she will talk to you about it. If you have a pain, don't be afraid to go in, because there's nothing. Living like pain, you might as well shoot yourself. There's no sense. That's not the way to live. You want to be happy. Even though I'm smiling all the time and I'm in pain, sometimes it's a little too much. But you've been working on me, and you're doing a damn good job.
Well, thank you.
I hate to tell you that, but I have to. I don't want you to get a big head.
Don't worry about that.
Let's see. We have a couple minutes left to talk about. How can we wrap this up?
Well, I wanted to finish my rubber band explanation by saying when we take the pressure off and the healing is happening, we don't just leave you high and dry to wait for the rubber band to come back on. That's where the regular checkups come in, where we make sure you stay clear. We make sure you stay connected. So that's why when people say, oh, you get adjusted, meaning me, and I say, of course I do. Of course I do. I mean, look what I do all day. I have to throw myself around all day. I got to make sure I get checked. I have to make sure I stay clear. I have to make sure I stay healthy so I could take care of everybody else.
Well, you look healthy and you're clear, but I have to say I was pleasantly surprised when I first met you. I had in my mind this 6-foot lady or bigger, 300 pounds, going to chiropractic me and push me around, but I found this nice, wonderful young lady there.
Well,
and
thank you.
For me, she did a beautiful job for me. I'm on the table in maybe 5 or 6 minutes. Boom, and I'm out of there. There's no pain, no nothing, and I feel better.
Good.
And that's what I like about it, because if I don't, you'll hear about it.
I know.
And I know you will.
I know.
Well, folks, that about wraps us up here. The time went by fast, didn't it? Mm-hmm. Yeah, you're worried if it's going to go by, and it went by fast. So if anybody has any problems, call the good doctor. There's no charge. She'll just talk to you and tell you what you got. And I have some friends out there I know, they're always complaining about their back, but they're afraid to go anywhere. Go. She'll take care of you. Well, I guess that's it.
Thank you, Joe.
Dawn, thanks for coming on my show.
Thanks for having me.
And I always say, now look at the camera. You look at the camera. You ready?
Which one do you want me to look at?
Keep smiling. It never goes out of style. You like that, huh?
I have it on my wall at the office.
You have
now.
it on the wall in the office, yeah. Or another one's keep styling. It's contagious. See you later, folks, and we'll see you next time.